Cancer research has been underway for over 200 years, and many treatments have emerged and have helped patients become cancer-free. One such treatment is photodynamic therapy. What exactly is photodynamic therapy? Photodynamic therapy is a minimally invasive treatment that uses light and special drugs referred to as photosensitizers to treat cancer. Typically, the treatment is done by administering the photosensitizers throughout the body, ideally directing and accumulating selectively in the target tissue. At the time of administration, the patients are deprived of any light source to prevent premature activation. Then, the target tissue is irradiated with light of a suitable wavelength, which is usually around 600 nanometers. So, what are photosensitizers? Photosensitizers are tumor-specific photosensitive agents which absorb light of a specific wavelength in the presence of molecular oxygen and transform it to useful energy. In this case, the useful energy is the oxygen radicals which can kill cancer cells. Ideally, a photosensitizer should not cause skin photosensitivity, absorb light in the red wavelengths to be able to penetrate tissue, be easy to synthesize, and be unreactive to the biological components in the body for maximum efficiency. We've talked about what photosensitizers are, but where do they come from? It depends on the type of photosensitizers. HPD is found by removing iron from dried blood. Chlorines are derived from naturally occurring chlorophyll and are used on its own or dissolved in polyvinyl pyrrolidone. Protoporphyrin 9 is prepared by semisynthesis, starting from hemin, which is isolated from oxblood.
Leading institutions like Memorial Sloan Kettering Cancer Center and Johns Hopkins Medicines have reported cure rates exceeding 90% for certain skin cancers. Photodynamic therapy is also transforming the way we treat vision loss, especially in patients with wet age-related macular degeneration. At the Wilmer Eye Institute and Bascom Palmer Eye Institute, PDT with verteporfin known as Visidyne has been shown to significantly reduce the risk of vision loss. Clinical trials have demonstrated that PDT with Visidyne reduces vision loss risk by up to 50% in patients suffering with wet AMD. In the realm of dermatology, photodynamic therapy is offering relief to patients with severe acne and psoriasis. At institutions like University of California, San Francisco, photodynamic therapy has shown significant reduction in acne lesions and improved symptoms in psoriasis patients. PDT is leading the way as it has a lot of benefits. PDT is a targeted treatment. Photosensitizing agents target abnormal or cancerous cells only, leaving healthy tissue unharmed. Unlike traditional invasive surgery, PDT is minimally invasive. A photosensitizing agent is applied or injected, and light is used to activate the treatment. With less pain and quicker recovery times, PDT offers a more comfortable path to healing. PDT isn't just a standalone treatment, it works synergistically with other therapies like surgery, chemotherapy, or radiation with doctor's advice. This enhances the effectiveness of traditional treatments. However, it also has its limitation. PDT has limited penetration depth. The light used in the therapy can only reach supersurface level conditions. This makes PDT less effective for treating tumors deep within the body or in internal organs. Another drawback is photosensitivity. After treatment, patients can become highly sensitive to light due to the photosensitizer remaining in their tissues. This sensitivity can last for days or even weeks, which can interfere with daily activities. In some cases, incomplete response or recurrence of disease may happen. Additional procedures may be required if the condition doesn't fully resolve. Surgical procedures or chemotherapy may be required to manage the disease even after PDT treatment.
Diving into the mechanism of photodynamic therapy, there is type 1 and type 2. Type 1 is radical formation. A ground state photosensitizer is excited to its triplet state by absorbing light energy. It then donates an electron or proton to a cellular molecule forming radicals. Radicals combine with molecular oxygen, forming a radical oxygen species such as superoxides. These superoxides react with itself, forming hydrogen peroxide and oxygen via dismutation. Superoxides reduces iron 3+ to iron 2+, which catalyzes the breakdown of hydrogen peroxide to hydroxyl radical by the Fenton reaction. Type 2 is a singlet oxygen formation, where the triplet PS directly transfers energy to molecular oxygen, forming the singlet oxygen, which is very reactive. Lastly, oxidative damage occurs when ROS and hydroxyl radical from type 1 and singlet oxygen from type 2 causes oxidative stress to DNA, protein, and lipid membrane, resulting in apoptosis. As research advances, photodynamic therapy continues to show promise in enhancing patient outcome.